Hey, it's Birdman. Time for another Summit Healthcares. We're here in the studio, and I have with me Deanne Davies. And since we've last spoke, your title's gotten longer.
It has. Our department has grown, greatly grown.
So what is that title?
So I am now the Director of Early Childhood Outreach and Pediatric Psychology for Summit Healthcare, including what most families in our area know as Healthy Steps.
Okay, Healthy Steps. Now, yes, Healthy Steps we know because when our kids were in school, like, actually going every day,
Way back when.
they would have programs that come in and do that. And then you also do the things with, I think, eyewear, eyeglasses, or eye testing in doctor's offices, things like that.
Yes, we have master level child development specialists who are highly trained, and they work alongside elbow to elbow with the pediatric providers at Summit Healthcare, providing all kinds of child development, all kinds of screening for postpartum depression, for child development along the way, and for hearing and vision, which is what you're referring to.
Okay, we have you in here today to talk about a little bit of a different topic, but kids and the fact that they're at home.
Yes.
They don't know why they can't go outside and play with other kids, or why we're not going places. So
Right.
give us some help here, maybe.
So today I'm going to talk with you about the child development and child psychology piece of what we do. And that's working with parents to help them understand young children's development and what they're capable of understanding and what they're not yet capable of understanding. So we've received many questions from the parents we serve. We serve over 3,000 parents a year in this area, and many of our parents have asked, how do I talk with my young child? How do I know if my young child is stressed from all of this COVID-19 and the disruption of their lives? Or are they? Or are they too little? Are they too little to really even know anything?
Right.
We know through studies and research that, and 20, 30 years of it, that this can actually be very stressful, even on a newborn. It can be stressful on a young child. Their routines are disrupted. Their parents might be afraid. Their parents might have some reactions or even just talk about their fears about COVID-19. And that kind of energy around a young child, even a newborn, will stress them out. They feel it. They can't talk about their emotions, but they can show you their emotions through behavior.
Wow. Okay. What are there any signs that we need to be looking for as parents, or
Sure.
things that we need to be aware of?
Well, this will be easy for parents. You know your child best. You are the expert on your child. And we know that children change in behaviors. So maybe if they're the preschool age to the early school ages, they might regress in their behaviors. So they may want you to hold them more, to rock them. They may not be toileting where they were before. They may not be sleeping well where they were before. You'll see changes in behavior like that. With your toddler group, you might see increased tantrums, or you might even see withdrawal. And those can be indicative of, they do those things anyway, right? Kids will just go off and play by themselves to take a break. But this is a little bit different than what you're used to. This is something you're like, what is this? And it's not going away in the 5 minutes that it normally takes. This is more frequent, and this is longer in duration.
Okay.
Yeah.
So if something's going on and you're kind of like, homebound, what resources are available, and what can people do?
Well, they can always call their Healthy Steps specialist. We're there for them. We are on the job. We are on the front lines in pediatric practice to support our families and help get them through this. We are providing well child care alongside the providers so that nobody misses anything and we don't miss development along the way, which is very important to healthy outcomes for little ones. And so you can call us. And you can call your pediatric practice and ask to talk to a Healthy Steps specialist if you go to Summit. You can call our office. We usually have one person there a day, and they can field the calls. And the other thing you can do is try to establish a routine. Try to keep whatever normalcy you had before all of this as part of your daily routine. That really helps children feel safe and secure and like they know what's going to happen next.
Right.
There's a lot of safety in there.
So You guys moved because we haven't talked to you since for a while, and you were up in the Pine Top Lakeside area. I wasn't sure if you've actually moved, and not that it matters now, but yeah.
Well, our Healthy Steps, our early childhood and pediatric psychology offices are still in Lakeside, right next to the
Okay.
Chalet restaurant. Yeah, in that suite. We actually, our Healthy Steps team works out of the pediatric practice in the outpatient pavilion
Okay.
on the third floor.
Very
Yeah,
good.
that's
Awesome.
where that team is.
Okay. Anything else that we should be aware of?
Just take it easy on yourselves, get self care in for the caregivers, and take some deep breaths. Take some deep breaths with your little ones, and take time for you guys.
Hey, that's going to be it for this edition of Summit Healthcare. Everybody be safe out there. Wash your hands, of course, and we'll see you next time here.